Bloodborne pathogen protection plans are crucial to protect people and products in the workplace. Bloodborne pathogen protection is crucial because they can cause severe illness and death through exposure to contaminated blood and body fluids for employees, visitors, and customers. A bloodborne pathogen, or BBP, is an infectious microorganism in human blood that can cause disease, with hepatitis B, hepatitis C, and human immunodeficiency virus being common examples. Transmission occurs through exposure to infected blood or certain body fluids via broken skin or mucous membranes. Safety measures, such as the OSHA Bloodborne Pathogen Standard, include universal precautions, proper hand washing, the use of personal protective equipment, and engineering controls to prevent exposure. The OSHA regulation that covers bloodborne pathogens is 29 CFR 1910.1030. This standard, found in Title 29 of the Code of Federal Regulations, mandates employers to implement measures such as exposure control plans, engineering and work practice controls, training, and hepatitis B vaccinations to protect workers exposed to blood or other potentially infectious materials. The key requirements of the standard include: Exposure Control Plan. Employers must establish a written plan that identifies ways to prevent or minimize employee exposure to bloodborne pathogens. Engineering and work practice controls. These controls are used to eliminate or minimize exposure, such as using safer medical devices and following specific work practices. Hepatitis B vaccination. Employers are required to offer the hepatitis B vaccine to workers who have occupational exposure to bloodborne pathogens. Hazard communication and training. Workers must receive training on the risks associated with bloodborne pathogens and how to protect themselves. Record keeping. Employers must keep records of employee training, exposure incidents, including a SHARPS injury log, and evaluations following an incident. And post-exposure evaluation. Employers must evaluate all exposure incidents and document the circumstances. The most common types of bloodborne pathogens are: hepatitis B virus or HBV. Causes liver inflammation and damage, with a vaccine available. Hepatitis C virus, or HCV. Transmitted through contact with infected body fluids. Causes severe liver swelling. And human immunodeficiency virus, or HIV. Can lead to severe illness and requires specific precautions. Exposure and transmission can occur when blood or other potentially infectious materials come into contact with a healthy person's blood through broken skin. This includes cuts, abrasions, sunburn, blisters, and even severe acne. Mucous membranes. Contact with the eyes, nose, or mouth, such as from a splash of contaminated fluid. And needle sticks and other SHARPS injuries. A high-risk activity, especially in healthcare settings. To prevent bloodborne pathogen exposure, consistently practice standard precautions, including hand hygiene. Wash hands thoroughly with soap and water as soon as possible after an exposure incident, after removing gloves, and whenever hands are visibly soiled. Personal protective equipment. Wear gloves, masks, goggles, and gowns when there is a risk of contact with blood or other potentially infectious materials. Handle sharps safely. Always handle needles and other sharp devices carefully. Dispose of them immediately in designated, puncture-resistant sharps containers. Disinfect surfaces. Clean and disinfect work surfaces and any equipment that may have come into contact with blood or bodily fluids. Follow standard precautions. Treat all human blood and body fluids as if they are infectious to minimize the risk of transmission. Avoid risky behaviors. Never eat, drink, smoke, or apply cosmetics or lip balm in areas where there is a potential for exposure. And utilize CPR barriers. Use a pocket mask with a one-way valve when giving mouth-to-mouth resuscitation. In a workplace, bloodborne pathogen engineering controls isolate or remove hazards from the workplace, while work practice controls alter how employees perform tasks to minimize exposure. Engineering controls are the primary method for controlling BBP exposure and include using devices to create a barrier between the worker and the hazard. Examples include SHARPS disposal containers, These are puncture-resistant, leak-proof, closable containers specifically designed for the disposal of contaminated sharps, like broken glass or exposed metal wires. Biohazard waste containers. Containers marked with a biohazard symbol provide a secure, designated place for potentially contaminated waste and materials. Hygiene stations. Readily available hand-washing facilities are crucial. In areas where hand-washing stations are not immediately accessible, antiseptic hand cleaners and towelettes must be provided. Emergency eye wash stations and safety showers. These are necessary for flushing areas of the body that may have been exposed to blood or other potentially infectious materials. And containment equipment. Secure areas can be designated to isolate contaminated materials before they are picked up by a hazardous waste handler. Work practice controls are procedures that change the way a task is performed to minimize the risk of exposure. Examples include universal precautions. Employees should treat all human blood and other potentially infectious materials as if they are infectious. This includes preparing for a potential incident by having personal protective equipment ready and knowing the proper cleanup procedure. Safe sharps handling. Never recap, bend, or break contaminated needles or other sharp objects by hand. Contaminated broken glass should not be handled with bare hands. Use tools like a brush and dustpan, tongs, or forceps. And immediately place contaminated sharps into an appropriate sharps disposal container. Contamination prevention. Perform all tasks involving blood or other potentially infectious materials in a way that minimizes splashing, spraying, or spattering. Do not eat, drink, smoke, apply cosmetics, or handle contact lenses in work areas with potential BBP exposure. Hand washing. Wash hands immediately after removing gloves or other PPE, and as soon as possible after any contact with blood or other potentially infectious materials. Trash handling. When emptying waste containers, do not use your hands to compress the trash. Lift and carry bags away from your body to avoid contact with potentially contaminated items. And specimen and laundry handling. Use leak-proof and labeled containers for specimens or contaminated laundry that need to be stored or transported. Keep contaminated laundry separate from other laundry and handle it with appropriate PPE. Even following all of the safety practices, there is still the potential for exposure to bloodborne pathogens. Here is what to do after exposure. Wash the area. Flush exposed skin with soap and warm water or flush eyes with clean water, saline, or sterile irrigants. Report the incident. Inform the supervisor or healthcare provider about the exposure immediately. Seek medical treatment. Immediately seek medical treatment and report the incident to the supervisor. And follow up. Attend follow-up appointments with the healthcare provider as directed. Monitor for any signs of infection, such as fever, chills, or pain. An organization's Hepatitis B vaccination program, driven by OSHA regulations, requires employers to offer the vaccine to workers at risk of occupational exposure to blood or other potentially infectious materials. The program must provide the vaccine at no cost to the employee and administer it within 10 days of initial assignment to the relevant job. Employers must also train workers on the vaccine's benefits, safety, and efficacy, and include the program in their written exposure control plan. Here is some information on vaccine administration. The hepatitis B vaccine is typically a 3-dose series administered on a 0, 1, and 6-month schedule. Vaccination is not required if the worker has previously completed the vaccine series, has demonstrated immunity through antibody testing, or if the vaccine is medically contraindicated. And a written opinion from a licensed healthcare professional must be obtained within 15 days of the evaluation to confirm whether vaccination is indicated for the worker. OSHA requires hazard communication and training as part of the bloodborne pathogen exposure standard. Hazard communication requirements include exposure control plan. The facility must develop, implement, and maintain a written ECP that is specific to the workplace. It must identify employees with occupational exposure and outline the methods for compliance, including control measures and procedures for evaluating and responding to exposure incidents. The ECP must be reviewed and updated at least annually. Warning labels. Biohazard warning labels must be clearly posted on or near areas where blood or other potentially infectious materials are used, stored, or handled. This includes regulated waste containers, refrigerators, and freezers. Red bags or containers can be used in place of labels on regulated waste. And availability of information. The employer must ensure employees have access to relevant information and documents related to the BBP standard. The training requirements include: all employees with occupational exposure to blood or other potentially infectious materials must receive BBP training. Training must be provided at the time of initial assignment to tasks where occupational exposure may occur, and at least annually thereafter. Additional training is required when new or modified tasks or procedures affect an employee's occupational exposure. The training must include, at a minimum, the following topics: the facility's ECP and how employees can obtain a copy; epidemiology, modes of transmission, and symptoms of bloodborne diseases, as well as how to recognize tasks that may involve exposure; methods to control exposure, such as engineering controls, work practice controls, and the proper use of personal protective equipment; information on the hepatitis B vaccine, including its safety, efficacy, benefits, and how the employer will provide it; procedures for emergency response involving blood or other potentially infectious materials, including what to do if an exposure incident occurs, as well as the reporting and medical follow-up procedures; and labels, signs, and color coding used at the facility. A workplace facility's bloodborne pathogen record-keeping requirements are governed by OSHA and fall into 3 categories. They are: medical records. Confidential medical records must be kept for all employees with occupational exposure to blood or other potentially infectious materials. These records must be maintained for the duration of employment plus 30 years and include information such as the employee's name, identification number, hepatitis B vaccination status including declination forms if applicable, medical test results, and details of any post-exposure incidents and follow-up. Documentation of the routes of exposure, circumstances, job duties, and a healthcare professional's written opinion are also required after an exposure incident. Training records. Records of BBP training sessions must be kept for employees with occupational exposure for 3 years from the training date. An injury log. Unless exempt under OSHA's record-keeping requirements, a SHARP's injury log must be maintained. This log should include the date of the injury, the type and brand of the device involved, the location of the incident, and a description of how it occurred. Employers are required to have programs to protect their workforce from all hazards in the facility, including from bloodborne pathogen exposure. We hope you found this training valuable. Please click the subscribe button to access additional Food Sure training videos.